Each legislative session, KHI is hard at work, keeping you informed on the latest health policy discussions from across the street in downtown Topeka. Health at the Capitol is a KHI production, a monthly recap with our legislative monitoring team, offering you a closer look at policy work happening now in Kansas and coming up. Thanks for joining us for Health at the Capitol. I'm Teresa Freed, your host, and I'm joined by Linda Shepard and Valentina Blanchard, who are our legislative monitoring team. All right, so we are talking about First Adjournment, which happened last Friday. So that's where we're at in the legislative session. So Linda, just starting us off with kind of what's been happening.
Yes. So last week was a busy week, obviously. Last week of the session before First Adjournment. The legislators, they were here very late on Thursday night and on Friday trying to get all the things done that they needed to get done. Just at a high level, they had two really important priorities for the session, a lot of sessions, but one different was getting the budget. That's something that they have to do every year, and they were working on that pretty much to the end. Conference committee met numerous times last week, and actually starting the week before, even trying to get to their budget. So there's a budget that is going to Governor Kelly for consideration. I have certainly heard and expect that there will be some line item vetoes, and so there will be some things that they'll want to work on when they come back from the veto session. The other big thing that really doesn't have anything to do with that's in terms of health, but they were really focused on getting a property tax bill done, and they got something done, but it's sort of a two-piece process for them, and so I think there'll be some additional work maybe on that area when they come back. But that seemed to be a real challenge for them to get to agreement on that. So that's done.
Sort of the indirect tie to that is, obviously that has an impact on families when they can't necessarily afford property taxes or older adults, and so it sort of speaks to the affordability aspect. So very indirect, but however, still linked to health as many things are, right?
The other thing that I wanted to mention was the fact we talk about our small but mighty legislative monitoring committee, our project team that we have here at KHI. And one of the things that happened last year, and so, I've been doing this for about a dozen years now. And so anytime something happens that I haven't seen before, that always stands out in my mind. That the number of bills that they shuffled around. So, I think Val was going to mention this, we have some bill numbers, that we've been using all session long. And as of last week, they become meaningless because the text of that bill is moved into this bill. And then so they were doing a lot of that at the conference committee level, doing a lot of that shuffling around and moving bills into shells that they had removed other language out of. And so it's been a little bit of a challenge trying to keep up with those. And I think also, this is Wednesday now, the week after, or the Wednesday after First Adjournment. And the revisor's office is still busy trying to get, new versions of bills updated and ready to be sent on to the governor. So they're still working through that process. And so if you want to see a final bill, there are some, and there are some that are not available. So
can you talk a little bit maybe about what's the strategy in that? Why all the movement?
Well, a lot of times if they have things that they want to get done, and they really are just starting to run out of time of taking those bills, they will use. And I used the word shell earlier. They'll have a bill that's maybe already gotten way through the process, and they take the text out of that bill, and then they put text from other bills that maybe haven't gotten as far into that. And procedurally, through the rules, that they're allowed to do that, and so it makes it so that they can look at all of those at one time when it goes to the floor, and so they can get a lot. They get a lot done by some movement around of some text within the bills that are already progressing.
And so we're already still seeing rather the not an expedited session. We used that term a little bit last time, but it is really a quick moving one.
No, it is. And they even sped up this year even more so. I think we mentioned during our preview conversation that this is the second year that they've been on this accelerated schedule where they are really focused on the 90 days that are in the in the Constitution, and really just getting that done. So not taking much in the way of breaks anytime during that 90-day session, which is something they had done in the past. So, here we are. First adjournment was last Friday. They'll be back on April 9th for the veto session, maybe a 2-day veto session, and then they'll be done. And again, as we discussed, all of the House of Representatives positions are up for re-election this year. So they're anxious to be able to get out and do their campaigning now.
Yeah, that makes sense. All right, well, let's take a closer look at some of the bills that made it through. Some of them got a little bit stalled, and so we'll talk through some of those items that we mentioned last time. So we can start maybe with the BPMs and a reminder of what that stands for.
Yeah, so the pharmacy benefit manager bill did end up getting passed. So there's some new regulations that will be associated with how they register in the state and things like that. So that bill is still pending enrollment. So once a bill is enrolled, the governor has 10 days to sign it into law. If she doesn't sign it within those 10 days, then it just automatically becomes law. So that's one of the ones that's still waiting to get sent to the governor.
A couple of things that and one thing that stands out really in my mind that is a big provision in there. So PBMs, pharmacy benefit managers, these are organizations that are used by health insurers to help manage the whole drug part of the prescription drug part of their plans. And for a long time now, there has been some ongoing concerns in terms of how they do what they do, basically, and the lack of ability of being able to have a real clear understanding of how that process works, so how they determine which drugs are available, at what cost, how much is going to get, how much are the pharmacists who are dispensing those bills, how are they going to get paid, and how much, and how that compares to other things that they're doing. So there's been this overall transparency concern. And a lot of states have started a few years ago to start putting some state level legislation in place to get some more regulatory authority over these PBMs. And there's also action happening at the federal level as well. And I think because that really hasn't been fully fleshed out yet, some states like ours are continuing to look at doing something for themselves. I will say that one piece in this bill that is, I think, is very important, because I think it remains to be seen if it's controversial, or I think right now people are concerned that it is. So one of the things that we had heard from talking to the pharmacists was the amount of money that they get reimbursed for a drug that they purchase and then dispense for that particular company's enrollees, and and those are arrangements that are made between the PBM, often in the pharmacy, about how they're going to get reimbursed. And one of the things that we heard about was this idea of, Val, I'm just going to forget this word right now, the dispensing fee. Is that what it? Yeah, it's the dispensing fee that they get paid. So it's like you're going to get reimbursed for the drug, but you're also going to get this extra fee because of the process that you went through to get it ready for our patient. And so in this bill, there is a specific provision requirement, $10.50 dispensing fee in there that will the PBMs will be asked to pay for that. And of course, then the question remains: well, does that just get passed down to the consumer at some point, because the PBM now has to pay this additional fee? So it's something I think particularly the independent pharmacies, so the small community pharmacies, were saying, we really need some help because we're not getting reimbursed enough to really keep our operations going. And so I think that was the purpose for that fee. But we'll see what happens with that.
Well, I appreciate the clarity. I think that is some helpful background information. So another one that we've been watching is the cell phone bill. And so we know that one got signed into law. And so what does that mean now?
So that means now that schools will be required to either adopt a policy if they don't already have one, or change their policy so that it matches what was passed in the bill. One of the discussions around that was the fiscal note associated and what the cost would be to districts. So I think there's still some details that will need to be worked out, but it was a bipartisan bill. Both sides were very excited about it, and the governor had a whole signing with right. photos and all of that. So it's definitely a bill that seems really important to Kansans, and we'll see kind of how it rolls out now that it's been signed.
Yeah, and I noticed this is not necessarily something that Kansas is the only state doing this, but we're one of the first states to do it, right?
Yeah, we're one of a few. Florida was the first state to do anything. I think back in before 2020, they passed a bill. So we're definitely not the first, but we're definitely not the last in this case. We're kind of right in the middle, and then we're also seeing some other countries do some things related to cell phones and youth usage as well.
Yeah, and I think this is probably one of those topics that, obviously will continue to come up. Maybe not a cell phone ban in schools, but the regulation of content for students and young people. For example, seeing the social media lawsuits and the decisions coming from that, there is this growing interest in protecting children from a very rapidly evolving technology that kids have some exposure to. So any other topics related to that have come up during this session, or that you would anticipate maybe we might see down the road?
So there was the they kept calling it the app bill because just for short. But this was a bill that again, as we talked about at the beginning of the session, there has been so much focus on child welfare issues, things to protect children, things that are to improve situations for children. And so this bill came up and would be placing some new requirements on the app stores. To try to make sure that the people that are going onto those app stores that are buying those apps are actually of age, and putting some requirements on them about how they would have to determine the age of whoever it was that was trying to get the app. And and again, like everything else, I mean, this is another controversial thing, because the app stores are saying, no, it shouldn't be us. It should be a different, a different entity within the line of the internet. And so it's something that and again, lots of states are trying to figure this out, trying to figure out how do we best protect the children from things that we're concerned about on the internet.
It'll be a very interesting discussion moving forward, of course, and we'll be paying attention. So another hot topic was related to the nursing board, and there's been a lot of activity within the last couple of weeks, I think, about that. You want to touch on that?
So the nursing board situation, that actually started before the session happened. They had an interim committee that was meeting, that was looking at workforce issues and other things, and this issue came up that there had been instances of the way that the nursing board interpreted the statutes and regulations that they had in place at that time, that were in place at that time. How they respond and how they characterize situations in which a nurse her license lapses, or something in the re-registration, relicensing process gets dropped somewhere, and then how is that characterized, and then how does that go on to the nurse's record for future? And so there were a number of nurses that came in and told stories of their own experiences about going through that, and the fact that if that would show up on their record as non-professional conduct, then tried to go get other jobs in different places, or several of the nurses are interested in belonging to one of the compacts, which we might mention later, that shows up in their record and potentially interferes with their ability to be able to be that participant or to get licensed in another state. So this really was a major overhaul of the legislature went as far as voiding those types of things that had happened to nurses clear back to 2005. Yeah, so like a really big step backwards, and said all of those types of rulings from 2005 to current were basically voided and would be removed from their records at some point. And I think that and then going forward, the way that those types of what they refer to as non-professional, I mean, they really don't relate to their working as a nurse. These were the paperwork things that happened in the background, that those sorts of non-professional violations or situations that technically do violate the law, but providing some more flexibility for how the nurses are notified what their when their license is coming up for renewal, or all of this hasn't been done and you have a certain amount of time that you have to get this done with. But really taking away, I think, that whole idea of this is something that affects your ability to be a nurse, and I think that's really the issue for that.
And it seems like workforce was a very big topic, whether nursing or another health-related profession. So, Val, do you want to talk about some of those pieces of legislation that we reviewed earlier?
Yeah, so we talked about compacts, I think, a couple times, and they did move all the compacts into one bill in a conference committee. So occupational therapy, respiratory therapy, athletic training, those are all going to be compacts that Kansas will be a part of. And then once the seventh state signs, if not already, those compacts will be enacted. And then there was also some bills kind of related to some of the student loan programs and addressing some of those workforce shortages at the education level versus once someone is already in the workforce.
Okay, and so when we talk about compacts, describe a little bit about what that means in terms of flexibility to where professionals work.
So it just makes it easier for someone who may be licensed in Missouri to get their license in Kansas, or vice versa, or whoever is part of the compact. So someone could move to the state and start practicing sooner than if they had to go through the application licensure process from the very beginning.
Okay, all right, and so just moving on now, I guess, to the veto portion of our discussion here. There is a difference in opinion, I think, on some of our pieces of legislation by the time they hit the governor's desk. And so are these vetoes out of the ordinary, do you think? Or it seems like there have been a lot lately, or is this pretty typical when we get to this stage?
I would definitely say it's not out of the ordinary. I mean, I think throughout, certainly through any type of situation that you have, where we have here in Kansas, with a Republican majority legislature and a Democratic governor, and so for the last 8 years, Governor Kelly being in that role, and she is, she's been very public about the issues that she cares about, or the things that she thinks are things that should not be being dealt with at the legislative level. So I think that it's not unusual for her to do vetoes, and I think there's only been 3 or 4 so far yet. Although, as we talked about earlier, there's a whole bunch more bills being headed to her desk. Mm-hmm. But yeah, the bills that she has been vetoing have been overridden, and right. that happened even before, because she had signed some of those even before they left on Friday. So they addressed some of those then.
Okay, and I'm sure there is some strategy already being developed, because they would anticipate that veto happening. But it's a process to override a veto. Can you talk a little bit about that?
Yeah, I think so as Val mentioned earlier, when a bill gets passed, that bill goes to the governor, and she has 3 choices. She can go ahead and sign it right away. She can veto it, or if she can just wait for 10 days and it will become law if she takes no action. And you're absolutely right. From the legislative perspective, when they're passing bills, I mean, obviously they're the proponents and opponents are working for their particular position in each of these bills. But one of the things that is known at the point that a bill does go to the governor is whether or not is the number of votes that they had in mm-hmm. favor of the bill. So that, is the bill going to be veto proof or not? Because if they didn't have enough people to be in favor of the bill and she vetoes it, sometimes it changes when they come back for the veto session. But sometimes they know ahead of time, we're not going to have enough votes to override it. So there is some strategy there, and I think it obviously those of us who are watching this gives us some ideas of that's probably going to get vetoed because she's talked about it before, and yes, it appears they do or they don't have the veto proof number of votes. So
that makes sense. And as you mentioned, veto session or veto, this portion of the session is happening we're about a week away now.
Yeah, they will be returning on April 9th. That's a Thursday. And right now on the calendar, it says Thursday and Friday. So they may be here for 2 full days.
Okay. Anything else that we want to talk about related to the session at this point?
The one thing that I think I might want to mention that that we've certainly focused a lot of attention on here at KHI was there's a bill that was introduced, Senate Bill 363, and that bill I was actually just speaking to a group last night, and I was sort of giving them some of the history on this. Several years ago, Kansas Legislature added a welfare reform committee. That had not been in existence prior to that time. And then a few years later, after the Trump administration came into office and had its Department of Government Efficiency, so DOGE, everybody became very familiar with that. Shortly thereafter, the Kansas Legislature created what we're now calling COGE, which is the Committee on Government Efficiency on the Senate side. So the Child Welfare or the Welfare Reform Committee is on the House side, the Government Efficiency Committee is on the Senate side. And immediately, one of the things that they were looking at was really just this very thorough review of all of the Kansas public assistance laws, and looking at things like eligibility, how renewals are done, how are there exemptions or waivers in these different programs. And so I really saw this bill as something that had been building for some period of time. And it's like they were doing a lot of their research and learning and trying to understand what the programs were and how they worked. And so we had this bill that was introduced that was going to make a number of changes to how eligibility determinations were done, some data matching that was going to be made available to both the Department of Children and Families and also KDHE, and in conjunction with them trying to make sure that the people who were getting approved should be approved, that the people that were on the programs were still eligible and qualified for the benefits. And I think that was some issues that they wanted to address. Throwing into this now with the passage of H.R. 1, OBA, lots of people call it, last year at the federal level, which also did a lot of this, was looking at all of the requirements for participation in SNAP and Medicaid. And so the focus really became on SNAP here in Kansas in these bills that we were looking at. But so that this bill came out, made some changes to how often they were going to do. They used the word redeterminations, and so was that like a review of your eligibility at that time, or whether that was just sort of some confirmation? I think that word redetermination kind of threw some folks because it's like, well, what exactly does that mean? And then there were some things that were in the bill that, and I think this often happens sometimes when the bills are drafted, there are provisions or there are things that are put in there that maybe at the moment that's done, we don't recognize that maybe there were some unintended consequences that can happen with that, or occasionally we'll run these situations where something that's being asked for actually violates federal law. And then so obviously it's like, well, the state can't do that because, we're required to do it this way under federal law. So those kinds of things happen. So, this bill went back and forth through a lot of different changes. And I think in the end, it ended up, this was one of the bills that Val was talking about. 363 was its number through almost the entire session until last week. And then it got moved into, which is now 2731. And but it looks very different from the way it did when it got introduced. And so it's there are some things in there about continuous eligibility for part of our disabled population, and so that would actually makes things easier for them, really. But there are some requirements for some more data matching going on between DCF and KDHE and some of our other state agencies and offices that would allow them to have information in probably a much more timely manner in terms of there's someone still remains eligible for SNAP or Medicaid or any of the other public assistance programs. So I think that data matching process is probably going to be a big lift for all of those organizations to figure out how to all communicate with each other in a way that's consistent. So some of those things have to be done on a monthly basis, that share of information. Some of those things have to be done on a quarterly basis. And so that is kind of a big change. But that bill, I think the focus really was on how often were those redeterminations going to be made and how extensive that was and how long it was going to take. And so the agencies were very involved in trying to help the legislators understand what the process was going to be.
Right. That's interesting. They have very different systems, and they are involved in the administration of federal programs that have different requirements. And so it'll be interesting to see how all that plays out. All right. Well, I do want to promote some of our products. So obviously, Health at the Capitol will continue monitoring what's going to happen the rest of this session and then through the summer and next year and all of the times after that, but also our Hill to the Heartland products, which are focused on things happening at the federal level and how those decisions and policies impact the state of Kansas in a wide variety of ways. So we are distributing information on that, whether it's kind of what we're watching, digest style information, or something that's a little bit more extensive, where we're taking a deeper look at some of those issues and what the implications are for Kansas. So we encourage you to check those out, and we'll see you next time.
Thanks for joining us for Health at the Capitol. Sign up to receive our emails at khi.org to get a weekly recap of health policy activity during the Kansas Legislative Session. You'll also receive our latest publications and information about upcoming events.